episode of Podcast DX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita. Ron will not be with us today.
And I'm Jean Marie.
Today, we're honored to sit down with Ariana Blockmon, a powerful advocate who has lived with multiple complex health conditions, including Ehlers-Danlos syndrome, Chiari malformation, arcuate ligament syndrome, spinal stenosis, and more. But today, we're going to focus on Mast Cell Activation Syndrome, also called MCAS. It's a condition that Ariana has written about extensively and experienced firsthand. Ariana, welcome to Podcast DX.
Thank you for having me.
Before we dive into your personal journey, let's just give our listeners a quick background or overview of what MCAS actually is. Mast Cell Activation Syndrome is a disorder where the body's mast cells, immune cells that normally defend against infections and help with wound healing, release too many chemicals and at the wrong time.
Right. And that over-release of chemicals like histamine can cause a wide range of pressure symptoms, symptoms like hives, flushing, abdominal pain, diarrhea, brain fog, low blood pressure, rapid heart rate, and in some case, even anaphylaxis. But let's get Ariana into the show now. Could you tell us when you were diagnosed and what the doctors are doing to treat your condition currently?
I was diagnosed, I'm 36 now. I was diagnosed, I believe, when I was 33. And the doctor that diagnosed me actually, he said, quote, I could diagnose you with this and treat you for this, but it's not like it's going to get you out of that wheelchair.
Oh,
And I've been diagnosed with it, I've been treated for it, and I'm now only using a wheelchair about 10% of the time. I'm using a cane, and that's a direct response, like a direct result of me having been treated
oh,
for this condition.
okay, all right. Wow,
Yeah.
wow.
So one of yeah, it's as has been said, it's a dysfunction of the allergic part of the immune system. We like to think about the allergic division of the body being separate from the immune system. So when we talk about autoimmune diseases, we tend to not think about that, but it is possible to have autoimmune diseases of this part of the immune system as well. And let me tell you, it's a doozy. There's actually not just histamine released by mast cells, but there's now been over 1,200 different chemicals, many of which we don't even understand really what they do, that are found to be released by mast cells. And the leading clinicians, it's said that this is a rare disorder, but the leading clinicians that study this disorder are actually saying they think up to 17% of the population has it. It's just mostly mild for most people most of the time.
And what were your symptoms
So
before you were diagnosed? What caused you to even go to the doctor?
what led me to go to the doctor ultimately was I continued to get, I was a journeyman electrician. I went to most of pharmacy school. I've had an interesting background, but I abruptly kept getting hurt. I kept getting ruptured discs. I was told I had degenerative disc disease. I noticed that my medical history was starting to follow the trajectory of the medical histories of all my family. My grandmother was a nurse. Her name was Lois. She was of the opinion that we had some sort of a genetic disorder, and she called it the family curse. She helped me take a 17-page family history before she passed to try to help get to the
Oh,
bottom of it.
wow.
And so I watched as my health and my diagnoses, I have 3 pages of diagnoses altogether now, as they started to take on the same, not only the same pattern, but the same timing as that of my mom and my grandmother and my cousins. And, and I really wanted to get in the middle of that. But it got to the point where I had diagnoses of both shoulder labrums being torn to the point that they wanted to do surgeries, both hips. I think at this point I'm at like 4 or 5 herniated discs. I'm not sure how many are bulging, spinal stenosis. But all of these things didn't fully explain why I was having problems walking and exactly what was going on with my nervous system. And I was still having uncontrollable migraine episodes that were leading me to the ER at least once a month. And a lot of times when I got there, they would do an MRI because I wouldn't be able to answer their
Oh,
questions.
wow.
They would start to talk to me and they would ask me like, "Hey, how are you doing?" And there'd be a delay, almost like if you have bad radio equipment, you have to wait for the response to get registered, and then you have to wait for your brain to process the response. And it could be that that was the level of pain I was in because it was exquisite, the pain. But also, it turns out I've had damage to my hippocampus
Okay.
on the right side of my brain. 40% of it disappeared between two MRIs 3 months apart. And they can't really explain why. And the consensus between, I've seen now like 36 different specialists, is that it's my mast cell activation syndrome.
Wow.
For some people, there is a neurological involvement, and a lot of times it attacks the hippocampus. I've had confirmed intracranial hypertension, and that's what was leading me to the ER. And for years, I was told that I was only having migraines, and I was telling him, I'm a farm girl. I was raised on a ranch. I would carry a 50-pound sack of feed on both shoulders. I've had some pretty bad injuries. I'm a trooper. Am I allowed to curse?
Sure.
Oh yeah. Oh yeah. Yeah, I do it all the time.
I'm quoting a physician in clinic. I had the physician that said I needed to have surgeries on both shoulders and both hips. He said, I'm going to diagnose you further as a hard ass.
Okay.
Yeah. Yeah.
Well, and I don't know if you
If you weren't such a hard ass,
no,
sorry,
I
go
was going
ahead.
to say there's a lot of memes online and things where the doctor is responding to saying, a patient came in with, pain 10 out of 10. And then they find out that the
Yeah.
patient's a farmer and they're like, oh my gosh, like that means,
Yeah.
that's serious.
Right. Right. And if it was
Yeah.
everyday,
Yeah. I grew up.
everyday American, 10 out of 10. It's like okay.
Okay. Yeah. But a farmer, it's like, oh,
Yeah, I grew up as a rancher, a cattle rancher, and there were no boys that were anywhere near my age, and I was a tomboy, so I was automatically out there in the thick of it, helping wrestle cattle and all of that. So I wasn't, another myth that a lot of physicians have. I also have Ehlers-Danlos syndrome, and I'm not sure there's so much to
yeah,
this, where to cut it
No.
off. But
Right.
very
Right.
complicated.
Yes, it is.
some physicians say that these things are rare, but the problem is they're not really rare. They're underdiagnosed. And once you've been diagnosed with one of these things, your odds of having some of the others goes up significantly because they're what's known as comorbid. So it's not just horrible luck on my part that I have 3 pages of diagnoses. These things all go
Right.
together.
Right.
And we don't fully understand why that is, but Ehlers-Danlos syndrome is often associated with mast cell activation syndrome, and I and many other people in my family are what people describe as double jointed,
Mhm.
and that also comes with easy injury to soft tissue, like frequently twisting your ankles and getting hurt easily. Uh, a lot of minor back injuries and even degenerative disc disease. You're too lax. Your tissue, your connective tissue is too loose.
Mhm.
Wow.
So they don't really understand what the connection is between those things, and I'm afraid my hippocampus has dumped. But yeah, so that's what led me. That's the long form of what led me to go to the
Okay.
physician that told me, I could diagnose you with this. However, it's not going to get you out of that wheelchair.
Sure. Sure.
Okay.
So I've continued to kind of go downhill since then. And as I mentioned before we started filming, I had another episode last night,
Yeah. You had
unfortunately.
a TIA, huh?
Yeah, it wasn't diagnosed, but I've been to the ER so many times, as I mentioned, and many times they did actually image me, and they didn't see anything. And that being said, I've had to have significant investigation since then. They found I had a Chiari malformation, which is where the bottom of the cerebellum is coming into the spinal canal.
Right. And
They didn't tell me
will
that.
they be doing surgery to correct that?
And does it have anything to do with the pressure buildup in your skull as
Oh,
well?
okay. Yeah.
I've been to a couple of specialists. If you're familiar with archaeology at all, you're familiar with the ancient procedure of
Hmm.
trepanning, where they poke a hole in the
Yep.
skull. And the cure for Chiari when they do the surgery is really not all that different from trepanning. They make a small hole, they remove part of the bone at the base of the skull to allow the excess pressure to come out, and they put some sort of a patch there. But they said that the degree of mine was small enough that they thought that the risks were too great and that the bulk of my symptoms were being caused by the mast
Oh,
cell, that my Chiari was more of a bottleneck and it doesn't allow pressure to get out like it could and like it
Hmm.
should. And that's fine until you get into a bad situation like with the mast cell.
I see. Okay.
Right.
All right.
Okay.
So one is kind of feeding into another one and compounding that one, and so the biggest problem
Yeah.
is they're all
It's you have like
piling
yeah,
up, right?
right.
Yeah, and I think that's one of the things that modern medicine misses a lot. I really wanted to bring this up actually, is even if you go into ancient Greece, the physicians there, I forget which physician, it might have been Hippocrates, it might have been another, said that disease usually occurs where there's more than one dysfunction that intersect. And a lot of physicians, they find one condition, they find one injury, one illness, whatever, and they stop looking. And then, maybe the person gets better, maybe they don't. If they don't, well, they've diagnosed the thing. Maybe the patient just isn't trying hard enough, whatever. Well, maybe that could be, but also what could be is that there's more than one disease that's causing a similar breakdown. And that's what actually makes it more likely. That's what mast cell activation syndrome, the research is coming to show, seems to be, is it's the cell danger response. It is your cells get broken down individually. It seems to involve the mitochondria to the point where they're not able to function in a healthy way anymore. And there's a lot of different things that can feed into that, from chronic viral infections to, a lot of people have long COVID. A lot of people have come down with this spectrum of illnesses that I have and had to start their diagnoses processes triggered by a COVID infection.
Right.
Okay.
And that's actually a pattern that a lot of people see, and there's several physicians that have this cluster of disorders as well that are trying desperately to figure out what's going on. It most commonly affects women, often my age. Um, but it starts in childhood for a lot of us. There's a lot of different versions of EDS. I'm talking about EDS
Mm-hmm.
now. A lot of people have EDS. There's a lot of different forms. They found, I think the last count was 13 genes that directly cause it. But something like 70% of the people that have EDS don't have any of those genes. And I have two genes that affect collagen of unknown significance for collagen 3 and collagen 11. And those two work together for a lot of really important things. And they probably do play a factor into my disorders, according to the geneticists I've seen. But I'm thought to be one of that 70% that is not gene directly gene generated. You know what I'm saying?
Okay.
It's thought that it's some sort of autoimmune thing, such as perhaps mast cell
Right.
activation
Right.
syndrome, because as we've discussed, there's this comorbidity that's unexplained. But yeah, when I was a child, I was viewed as hyperactive and disruptive. I was distracted by people giving me encyclopedias. And I remember being in severe pain in school from stomach acid reflux. And I remember most of the food that they'd give us, especially in church camp and Bible school and school, making me ill. And they wouldn't listen to me. I grew up in Oklahoma. They didn't care, for the most part, what kids did or didn't want to eat. Here it is, or you're not going to eat. And I didn't have the language to even be able to explain, this makes me feel sick. That's why I don't want to eat it.
Right, right. So
And
they're just
so
thinking
I'd
you're being
also
a
have
picky
these.
kid, and here it's food that you can't tolerate.
Right. And I also, as an adult, I was diagnosed with ADHD and autism level 1, which is also, those things are also very common with the rest of this cluster of disorders. But I didn't know about any of these things. And also, as far as my MRIs earlier, as far as surprise findings that I found as my diagnoses have gone further, that the MRIs and the ER missed, not only do I have this Chiari malformation, I've got tissue loss from these repeated pressure episodes, they think. Especially, I lost a large part of my hippocampus, as I said. I'm missing a part of my corpus callosum, which is the communication highway between the two lobes. And also, trigger warning for domestic violence. My father apparently decided he didn't want to be a father when I was a first trimester fetus, and he gave my mother rat poison. And my physicians and I have discussed all of this, and on my some of my findings are I have a slightly deformed shoulder and hip, and part of my cerebellum on the right side is about, or my right half of my cerebellum is about 20% undersized, and the right occipital lobe is about 20% oversized, almost like it's
Mhm,
compensating.
mhm.
But even as throughout childhood, I had problems with the left side of my body. The wiring is
Okay.
crisscross. I had problems with the left side of my body trying to catch balls. I had coordination problems if I had to use both hands together, or I've had optical deficits that have now been diagnosed as well. That my eyes don't track together. Sometimes in certain conditions, one of them will just wander off on its own and then come back. Uh, all of these things were missed until I was an adult.
Okay.
Okay.
I wasn't diagnosed with any of these
Mhm.
things. I was told I was clumsy. I was told that, sure, you're smart, but you just need to try harder when it came to math. And I had undiagnosed dyscalculia, which is like dyslexia but affects math.
And
Uh,
where you were living
unfortunately, that's.
I was
Oklahoma.
gonna say where you were living at the time was you were saying it was, like, more of a farm and rural, and where you're living now, are you
Yeah.
living in an area that has a more concentrated population of healthcare providers where you have better access to healthcare providers? Or are you utilizing, like, telemedicine, things of that nature?
For a time, I was working as an electrician and I was able to travel, and I lived in Kansas City for about 15
Okay.
years. But now I've moved back to Oklahoma and I have to travel. It's technically there's an ER that's about 20 minutes away, but
The level of care,
no
yeah,
one would like to go
okay.
there. Literally no one. And so the next closest is an hour, and the next one that someone would want their grandmother to be taken to is 2 hours away. And that's where most of the specialists are as well. There's almost no specialists any closer than 2 hours.
Okay.
Oh,
That must make it very,
yeah.
challenging.
Yeah, just not having access to the medical care that you actually need has got to
Yes.
be it's got to be
Yes.
stressful for you as well.
It's kind of a full-time job, unfortunately. And one of the unfortunate things is that I have found is, as I said, I have a varied background. I was a journeyman electrician. For 10 years, I went to most of pharmacy school, and I just decided, I wanted to help people. Is why I went into it, and I decided that wasn't the way to do so. And I also did undergraduate neurobiology research and was published. And so I come from a very unique background of problem solving and understanding mechanisms and being able to understand more what was going on with my body than the average patient. And that's really all that saved me because I've had also other rare things. Capillary leakage syndrome has happened to me because physicians were hesitant to continue to treat my pain, which, as you imagine from just what I've mentioned so far, is not
Mhm.
small. I was being treated with small dose tramadol, and a new physician didn't want to continue that, and so they put me on methocarbamol as a muscle relaxer, and I developed capillary leakage syndrome. It looked like I had tattoos appearing spontaneously on my hands. I had problems speaking for 2 weeks after that, which is yesterday I had a little episode of that as I alluded. Yesterday wasn't nearly as dramatic, thankfully. They gave me a pneumonia shot yesterday to test my immune system because uh, what I was going to say before, as far as mast cell having many factors that go into it, that's how you get out of it, is you start to find those factors and start to eliminate it. So in that vein, where we found that I have a couple of different kinds of immune deficiency. So this pneumonia vaccine is supposed to be a challenge of my immune system, and if it doesn't respond well enough in a month, I get a certain kind of therapy called immunoglobulin. Hopefully that insurance will pay for. But in the meantime, the rest of my allergic division of my immune system works too well, and I started having visual snow, which is a migraine aura symptom, and then you don't usually don't have that. And I got lost a couple times driving back from
Mm,
Tulsa, and that was my first sign that I had some cognitive issues going on as well. And that was right. I noticed that right about the time that the snow started in my vision.
okay.
And by the time I got home, I was having hemiplegia on my left side, which is weakness, and the left side of my face was a little weak. I couldn't feel it quite as in the same way as I could this side. And I was having just a little bit of droop of my arm and leg, and I fell down a couple times. And a normal person would go, "Oh my God, go to the ER." But here's the thing, I've been to the
Mhm.
ER so many times, so many different ERs. And that's to bring that back around where I was about 3 or 4 minutes back. That's the problem with these disorders is most physicians, they're told in medical school is that these conditions are rare, and they might get one blurb in one lecture about these disorders, and that's
Right.
it. And so they say, well, there must be someone out there that knows more about this than me. This isn't my problem. And there isn't. That's the problem. There isn't anyone out there who knows more about these things.
Right.
Certainly not in Oklahoma.
Mhm.
Okay.
And so there is nowhere really for us to go. Uh, there are a couple of primary care physicians in the state that try to focus on helping this population, and they almost have a cult following because of how desperate most of the people with these conditions are because they are so unheard. That's one of the things that unfortunately I've seen 37 kinds of doctors or so at this
Mhm.
point, over 200 individuals in this journey since childhood, and a lot of physicians are unfortunately technicians, and that's what my background is very as it is has led me to conclude they're not really practicing the art and science of medicine in a lot of cases. They're just following a protocol. And if the patient is outside of that protocol, they are completely lost and they do not know what to do. And some of them will then say, I need to learn more, clearly to be able to help this patient. And other patients that will come in the future, I've got to learn more.
That's what you
And
hope.
some will then also refer out. They'll say, I know of a colleague of
Mhm.
mine that knows more about this kind of patient, and I'll send them to them.
Right.
But unfortunately, what actually happens in a lot of cases is that the patient is told that they just need to lose weight or that they need to gain weight, depending on their situation, or they're told that they're too anxious, or they're told that they're too depressed. Here's the thing, some of the large, most common symptoms of mast cell activation syndrome and EDS is anxiety and depression. And if you have untreated pain and you have all of these medical conditions that you can't get treated and you can't get taken seriously for, you're going to end up anxious and you're going to end up depressed.
Sure, sure.
Yeah.
I had a Yeah, I had a psychiatrist for 10 years that was ready to fist fight with some of my other physicians because he was so frustrated. He said, "It's not a mental health issue. This is a physical thing that they need to seriously
Right.
investigate."
Well, for our listeners who might not really know, could you explain what MCAS is in like everyday language?
It's very difficult to do so, and that's part of the problem. A lot of physicians also don't have much of an understanding of what it is. But the mast cells, the problem is basic scientific understanding hasn't caught up with a lot of this. And that's what's affecting a lot of the patients that are like me, is we don't really know how a lot of these systems
Okay.
work. But it would appear that mast cells, they're produced in the bone marrow, they migrate out throughout the body, and they embed themselves into connective tissue, which is what's primarily affected with EDS. And it's possible that the mast cells are being biomechanically irritated by the fact that the collagen isn't quite what they're
Okay.
expecting. And that's why they're irritable, and that's why but no one knows, no one really
Okay.
understands. But where they are put in the body, they're concentrated in areas where the body thinks that there's a high likelihood of running into some sort of a contaminant or a bacteria or a virus or anything of that nature. There's a lot of them in the brain, which is, one of my favorite facts. And they're thought to be a direct communication, almost like a radio transmitter between the nervous system and the hormonal system and the rest of the body. So that's where those 1,200 plus chemicals that mast cells release come in. That's signaling from the nervous system to the rest of the body how things are going, what needs to happen, and that sort of thing, in a manner similar to the hormone system that we're already really familiar with. But much of how it works isn't understood at
Are there
all.
common triggers that will, like get a mast cell uh, symptom really activated, I guess?
That's one of the things also that's kind of complicating, is that there's so much variety between individuals. And as I mentioned before, what I'm coming to understand, and some clinicians are coming to understand, is a lot of different things can play into it. But which factors are playing into your collapse with mast cell determines what your symptoms are. So for instance, I have this IgG3 deficiency. Uh, if indeed that is a factor for me all the time, and I also tested only good enough on 8 out of the 23 pneumonia serotypes that they tested, it's possible, and that's forms of strep. It's possible I have a low-key strep infection all the time, which they've already found that I have systemic yeast that overgrows all the time and causes a spike of my neurological symptoms and other symptoms. Um, if I were able to get control of that through the immunoglobulin, then that might enable my body to stop being under attack all the time and perhaps calm down. Uh, on a similar note, I found that I have like 7 different dietary insufficiencies and deficiencies at this point, and I was having malabsorption without realizing it. I was eating a Mediterranean diet. I thought I was doing what I was supposed to be doing, and my body just wasn't absorbing the nutrients. And I was extremely low on vitamin D, iron, vitamin B1, and several other very important things, many of which directly contribute to mast cell stabilization. The mast cells can't be stable without certain things.
Okay.
My vitamin C intake was really not what it needed to be. Vitamin C is directly needed to stabilize collagen and connective tissue and it's also necessary to stabilize mast cells and to break down histamine. I found I did one of those consumer tests from 23andMe and a couple of other companies. You're able to actually download your DNA from them. It's part of the contract, and you can take it and upload it to a site called geneticgenie.org, and you can get a lot of information from them about certain genes that can affect the way that you process food and the way that you react to certain medications and things of that nature. And so I went and did that. And it validated what I'd already found through trial and error, and that's that I react to oxalates in food, which is found in beets and a lot of other foods. It's really a common plant substance. It's supposed to deter bugs, but certain individuals can have a problem breaking it down. And I have a gene that causes that to happen. I also have a gene that causes me to have problems with several other food compounds. And I'm able to make nutritional tweaks by changing some of my basic nutrients to compensate for some of those things. I'm able to make changes now that I understand that. For instance, I have the MTHFR gene, so I know now that I need to try to avoid synthetic folic acid, and I take methylfolate instead.
Okay, so you're slowly
Uh,
learning to like hack your body.
that's basically, I think, the only way out of mast cell is the hacking. But on the other side, that there's also the acute control. I've been on Nurtec for quite some time, and that is a migraine medicine, but it's also being used for mast cell more generally. But it seems to directly take down my intracranial hypertension in a very short period of time. So when I got home yesterday during my attack, I took one, and within 2 minutes, I could feel the pressure at the back of my head just dropping.
Okay.
And apparently that is, I thought I was just imagining it, but I looked it up, and I guess that is a known phenomenon when you have like rapid intracranial pressure drop.
No, this is gonna sound
But
really weird, and I don't even know how to ask the question, but do you ever have it's kind of like a sensation and kind of like hearing a noise like a rain stick? You know what a rain stick sounds like?
Like a rattle?
yes,
In your head.
do you mean like it, I get that sometimes. It's like at the base of
Mhm,
my
mhm.
neck, like where my neck meets my chest, sort
Okay,
of, in my
okay.
spine.
Sorry.
I've spoken to several physicians
Mhm,
about it and physical therapists, and the best like conclusion that we can reach is that I was extremely low in vitamin K2, and K2 is required for driving the calcium into the bones. And if you don't have
mhm.
enough, it can actually start to micro deposit in the tissues, and that might be what was going on with
Okay.
me. I have a significant amount of nerve involvement, not just central nervous system, but peripheral nerve. They think that I have uh, I already was diagnosed with fibromyalgia, periodic limb movement of sleep, restless limb, restless leg disorder, but also they think I have dystonia and small fiber neuropathy. But there is a neurologist shortage in Oklahoma, and so I'm possibly going to have to travel back to Kansas City to be able to get those evaluated and treated.
That's the, I can't even imagine that. Very stressful. We live here in Chicago where we have, a plethora of healthcare facilities and different, medical institutions and teaching facilities, so we do we're very, very lucky in that regard.
Mhm.
But yeah, when
Yeah,
challenging. Um, how
yeah.
how does this all affect your day-to-day life, and what other, um, hacks have you found out that help you get through the day-to-day, especially since it sounds like a lot of these issues would cause problems with your sleep as well, and that, feeds into depression and anxiety and just, day to day, but yeah, if you can't sleep, you can't function.
Yeah, my sleep is very fragmented according to the sleep study, and I have the periodic limb movement of sleep. They give me low dose Klonopin to try to help me sleep through the night and not move as much. I still wake up at like between 1 and 3 in the morning pretty much every night, whether I like it or
Mhm.
not. That's also associated with mast cell, especially the folks like me that have the central nervous system involvement. Apparently, there's a histamine dump that can occur during that period, and also the brain's lymphatic system starts to do sort of a street
Mhm.
sweep
Mhm.
operation during that time period, and that can cause whatever is collected in the brain to then go into the bloodstream. So then you start reacting to it a second
Okay.
time. And we think that that might be what's waking me up. We're not really sure, but a lot of times I'll wake up with hot and cold. I thought I was having menopause at
Mhm.
first. Hot and cold flashes together, which is
Not fun.
not a
Yeah,
good time.
can imagine.
You'll pull the covers up, a quarter inch, and you'll be
Mhm.
sweating literally. And then you'll pull them down a quarter inch and you'll be frozen to the bone for hours on end. But it wasn't menopause as it turned out. But also PTSD symptoms sometimes. I come from neglect and trauma, unfortunately, with my parents and some spouses as well. And that's another tricky thing with mast cell is I think a lot of people like me went to therapy. They've done all the things that they think that they're told that they're supposed to do. They go to all the group therapies and they do all the things, all the certain techniques, and they still don't find themselves recovering. Sometimes it's mast cell, unfortunately. And when your body starts to my reaction profile is different to different things. They found like 15 different food allergies, blood lab confirmed at this point, in addition to the mast cell. I also have something called alpha gal syndrome, which is spread. They don't understand what generates it once again, but it is associated with tick and trigger
Mm-hmm.
bites. And once you have acquired it, you react to dairy and not just cow, but also goat. I was very disappointed to find out that that was not a loophole. And also, you can't have any pork, beef, lamb, sheep, or goat, any of that. So, and that includes, there's porcine heart
Mm-hmm.
transplants and valves and all sorts of
Oh,
things. If you acquire alpha gal, that could be a real problem. I saw someone in an EDS forum discussing that they had gotten the Chiari brain
Right.
and
surgery
had a
and
bovine
they had a
cancer.
mesh
Yeah.
Right.
placed that was sourced from a pig.
Mm-hmm.
Okay.
And they had on their chart already that they had been diagnosed with alpha gal syndrome and that their clinician, they brought it up to their clinician, and their clinician was like, oh, yeah, it's going to be no problem. And the patient had severe
Oh,
problems,
wow.
had to go in and had to have a second brain surgery to get this removed. But yeah, it's endemic is the word. They've found it pretty much everywhere but Antarctica at this point, but it's not being talked about much. And I probably had it for years, and it was definitely driving the neurological aspects of this disorder for me. They had me on 4 Allegra per day to treat the mast cell to try to bring the histamine down. And the problem is they don't formulate Allegra even generic without lactose, which is of course from
Right.
dairy. So I was poisoning myself every day for years, and I had no idea. And at the height of it, right before I got diagnosed, before finally we figured out what was going on, I had a Euro sandwich with lamb and beef, and I woke up the next day, and it was like I had the tissue in my gums was just like dissolving, and I was having other, like pretty much the whole moderate radiation sickness symptom profile from it. It was that bad. It was like literally my immune system was dissolving me from the inside. And it was a real blessing to finally find out that I had alpha gal syndrome. Unfortunately, no matter what I do, my antibodies for it continue to climb. So I may never be able to have dairy again. But that's another thing that fed into my dietary
Mm-hmm.
insufficiencies and deficiencies is I have all these food allergies and I react to so many foods. Like if I have any citrus, I will end up with one of these brain swelling episodes for certain, and it only takes like 20 minutes. Uh, and it's very mysterious why it's so different for so many different people. But one of the things that I've noticed with myself and other people that I've found that have the data to compare to is I have this allergy to lemons, oranges, and limes. Well, what I also have is a gene that makes it difficult for me to break down phenols, and those things are really high in phenols. So it's possible that my immune system, and I've found that pattern over and over again with my allergies, it's possible that my immune system is trying to compensate. It's trying to tell me, listen, listen, dummy, you're poisoning yourself with these lemons, and we can't break down this compound in them, and it's making us sick. And if you're not going to stop for us, we're going to make you stop.
Yeah.
Say
Can't
what?
you get scurvy
Well, you could
if
have
you?
like rose hip tea and things.
Yeah. It turns out that I had a lot of the. We think of scurvy as Hollywood has given us this very specific perception of scurvy. It turns out that's end stage scurvy,
Mm-hmm.
Okay.
and there's a lot of in between where we're at and end stage scurvy. I had a lot of the moderate scurvy symptoms,
Okay.
and that was making my whole situation worse, as you might
Sure.
imagine. But once again, I even react to roses. I react to rosemary and oregano and lavender, and I had to switch away from Dawn dish soap because it was making the creases in my hands come apart, like literally dissolve. I had to switch away from all of my shampoos and conditioners and all of that to baby stuff because it was causing my scalp to do the same thing.
Hmm.
Uh,
And do you use an EpiPen for emergent problems, or does that not?
I have one. I have, I say I'm fortunate. I seem to have traded the brain issues for what a lot of mast cell symptom patients have, and that's the regular anaphylaxis. I've only been in anaphylaxis, I think, twice, like the full not breathing thing. I've never had to actually EpiPen myself, but I've had one for like 10 years
Okay.
now.
Okay. Wow. I mean,
But yeah, the other thing that really saved my life was Xolair. It's a expensive medication that's still very much not generic, and it's a once a month injection, and it literally binds the IgE in your body and sucks it out of your blood, allows you to get rid of it. Supposedly, that being said, your IgE, they want it to be under 100, and mine was 1200 the last time they checked. No matter what we do, it continues to climb.
would you be, would you be thinking about long-term care and wanting to move to Kansas City or another large city that has a better option for you for care?
I've thought about it, but I believe there's about 4,000 people in the Oklahoma EDS support group on Facebook. And that's just people that are on
Mhm.
Facebook, as I said, some of the clinicians that study mast cells specifically, they're saying they think 17% of the population are affected by this
Right.
disorder. So the so there's a lot of people here that are in need that, they also need care, and we just need more. Oklahoma is last on many things. I forget what the list is exactly, but we don't fare well on education. We don't fare well medically against other states. We don't fare well on maternal or fetal mortality and many, many other things. But the problem is the care is really not that much greater in Kansas City either. Right before I had to move down here, suddenly my husband abandoned me like this.
Mm.
Uh, right before I had to come down here, suddenly I was in the process of trying to find a primary care physician, and I've had several different ones tell me, I'm not sure what the role of a primary care physician is for
Mm-hmm.
you. You have all these
Mm-hmm.
specialists. And I'm like, well, I need you to coordinate the specialists. I need you to coordinate my care. I need you to talk to me about what they're doing and make sure that it doesn't interfere with what the other specialists are doing because they're not talking to each other for
Mm.
sure. And that's a real problem that individuals with conditions like mine run into as well is the specialists don't talk to each other and the specialists and the physician don't talk to each other either. And a lot of that is the insurance companies have driven appointment times so short and doctors are so stressed. They have such a load. They don't have the ability to trace out all of these issues. But where do patients like me go? Where should we go? There is nowhere, is the unfortunate
Right.
truth.
Yeah, we've talked about that on a couple of episodes.
And what
Um,
what treatments or lifestyle strategies have really helped you the most?
Unfortunately, I've had to give up working altogether. I couldn't walk there for the longest time. And it turns out it's very, as I said, a lot of it's very mysterious, but I kept having muscle guarding that was way out of proportion with my injuries, which are still fairly substantial, but I was super stiff. I was locked. I'm leaning forward right now. I was locked forward all the time, and all my muscles were very stiff, preventing me from being able to arch my shoulders or really lean back. And it was that way with my legs as well. My back, no one could really explain why. My neck, and it was remarked upon by several different physicians and physical therapists that this isn't really it's not really explained by your injuries. There's something more going on here that you probably need to look
Mhm.
into. And also, I was having, and I'm still having, some symptoms of Parkinsonism. Like if I try, those exercise balls they have at the
Mhm.
gym. That's like one of the large ones that you lean on, but they've sliced it in half and mounted it to a
right.
Yeah,
board.
Bosu. Yeah. Hmm.
There we go. They had me trying to stand on a Bosu ball, and they had me with guards and everything. But my legs were just you're not gonna be able to see it, but the they call it paradoxical muscle firing. My legs couldn't agree on how much firing needed to happen of each muscle to keep me balanced on that
Hmm.
ball. And so they were just over firing in a alternating fashion over and over again for like it was like a minute or two. Finally they got tired and they kind of started like coordinating a little better, but there's no explanation for why my body's doing that. And I have the diagnoses of intracranial hypertension and things
Mhm.
like that. I still haven't really gotten to see a neurologist. I've been trying and trying and trying and trying and trying. I've probably spent 80 hours, and I'm not exaggerating,
Hmm.
trying. And there's the primary care physicians basically say, this is a specialist problem, and you're like, well, there's not a specialist, and they're like, well, that is a problem.
Sounds like a problem.
Ah. I understand that you recently wrote an essay about MCAS. What inspired you to put your experiences on paper?
As I said, I come from a unique background, and that's enabled me to figure out a lot of this. I've had to figure out a lot of it on my own, unfortunately. My husband lost faith in me. A lot of my doctors did because they couldn't figure it out. Uh, and I knew that there was something going on. And I knew, once I got the genetics evaluation, I was able to push for the MRIs. And that's when I had been told I just needed to go to physical therapy for 2 years. And then suddenly they said I needed surgery on both shoulders and both hips. Same doctors. So a lot of this has been entirely self-directed, unfortunately. And I'm not trying to toot my own horn on this, but like a lot of other people faced with this situation would not be able to navigate it on their own.
Okay.
And that's messed
So
up.
you kind of put it on
And
paper as an essay in order to
yeah,
make like a guide for others?
I feel like it's a bit of a like a Hansel and Gretel sort of thing. As I make my way out of the darkness, I'd like to leave pebbles behind for those that are also desperate and they feel like they've just been left in the dark and they're desperately trying to find just anything that will help their situation because they've been told, like I was told, I can diagnose you with this and I can treat it, but it's not like it's going to get you out of that wheelchair.
Well, and that leads me to my question. What would you tell someone who's just been diagnosed with mast cell activation syndrome?
It's not hopeless and it's not magical, it's not mysterious. There are rules that your body follows that can be learned, and that just really comes down to education, unfortunately. And a big thing you can do to help with that is to join. There are a lot of really, really good Facebook patient-led support
Okay.
groups. And there are some that are more focused on positive support than others. Some can get a little negative sometimes. It's been said that people who get better tend to leave the community, which is part of the reason why I'm leaving the
Mhm.
essays. So that leaves a false perception that nobody ever gets better because the people that are there are in the thick of it. But there are other communities that are more focused on positive and finding tweaks that you can
Mhm.
make. I like to say that if you can find five, or if you can find 10 things that improve your situation 5%, that's a 50% improvement in your quality of life. And that is not insignificant. There's no cure for these things, but you can change the outcome of your quality of life quite a bit if you're able to figure out what your triggers are, if you're able to mitigate things. And a lot of physicians get lost on all we need to do is control the histamine, but there is so much more to it than just histamine. And that was a dead end for me. As long as I just try to suppress
Mhm.
histamine, I just lost more foods. I gained more allergies. I got more and more limited. I got more and more crippled. I had to give up work. That wasn't, and many, many other people with these conditions have the same experience. They just get almost, and they have to almost become bubble boy. Some people get so bad that they react to water on their skin. It's a, it's a chemical, mechanical reaction. It's not, I don't, to my understanding, it's not a true allergy, but that is how hyperreactive their system becomes, and how hyperreactive your system can become with these disorders.
Okay. What do you wish that emergency room staff would understand better about MCAS patients as they walk into the emergency room doors?
I'm not sure, to be honest with you. There is such a gap. Um, I've been yelled at by emergency room physicians for uh, not stopping crying because I was in such pain from my head literally wanting to explode. And it wasn't just figurative, it turned out it was literal.
Mhm.
I had to start getting the petechiae at one point. I had it looked like tattoo sleeves. The other time I had capillary leakage syndrome from my wrist all the way to my elbow on the undersides of my arms, both sides, really, really bad. And it just came up out of nowhere while I was sitting there for 8 hours in the ER with the head pain and everything. And abruptly they were like, "All right, well you can be seen now."
Mhm.
But I just really don't know, to be honest with you.
Okay.
There's just such a gulf on these sorts of things, and the problem is that there's quite this a lot of the situations that me and other people with these sorts of disorders find ourselves in, they're in an unfortunate state between emergency and this is fine to wait for 6 months for a follow-up. There's quite a few situations where, like yesterday, I know I had some damage to my hippocampus because I was having problems speaking. I was having the balance problems. I was having the problems navigating. I was having the visual snow. I was having the weakness on my left side. But I also know that if I go to the ER, they're not going to take me seriously, most likely. And even if they do an MRI, they're probably not going to see anything, just like they didn't before, because the damage is small and cumulative.
Oh,
So what do you do with that? It's so here I've been in sort of limbo, knowing that I'm having cumulative brain damage for well over a year, and I've still not been able to see anyone that has any ideas on what to do about it.
Well, and
Really,
given all of these situations, how do you manage to stay motivated and hopeful?
it's a real challenge. The interesting thing is a lot of people with EDS and MCAS, we have a lot of temperament things in common. It turns out a lot of us have been independently nicknamed things like silver lining because we see the silver lining in any cloud because everything is a struggle. And exactly what is a struggle can vary from day to day, but there's going to be some serious struggles. And I literally, some parts of my brain may not be available at all times, and sometimes left is right and right is left, and I just have to roll with that. And that's just been how it's been since I was a child. So having that kind of an experience of day to day life, it's not super obvious to people on the outside all the time that you're having these struggles, but it is to
Hmm.
you. And it gives you not only this sense of resilience and ability to keep going, but it also gives you a lot of compassion and empathy for other people that have more obvious struggles and giving people more benefit of the doubt when they say that they're
okay,
struggling, even when it's not obvious why.
sure, sure. Do you have any favorite resources that you fall back on? You were saying support groups on Facebook. Are there any websites? Are there any associations, any books that you've read so that we can put a list together and suggest opportunities for other patients to look into?
Um, there's a really good functional medicine provider named Dr. Paul Anderson that does YouTube content
Okay.
that he goes very in depth on quite a few topical issues, and they're pretty short videos, and he's pretty good at explaining things in digestible chunks. And I found him pretty late in this journey, but now when people ask me that question, I'll point him towards him because he does such a good job.
Okay.
But there's an Ehlers-Danlos Society that puts out a lot of information. They try to have symposiums. They try to help fund research. And as far as mast cell, there are a number. Unfortunately, a lot of these conditions, once again, mainstream doctors don't necessarily know what to do about it. Insurance paid doctors, that is. A lot of people that have the ability end up going to functional medicine and getting that sort of treatment, unfortunately. So a lot of the resources for things like mast cell are functional medicine doctors online that you're able to get what they're willing to share. And that's actually that genetic genie test that I mentioned. That's a test that's typically, from my understanding, it's $500 to $1,000 to get it done through a functional medicine doctor to get that same information. But it was free since I'd already taken the genetic
Okay.
test.
Well, that's good.
That was a real resource for
Hmm.
me.
Yeah,
Hmm.
yeah, that's good advice. Are you like an only child, or do you have siblings that are sharing these problems with you?
Interestingly, I have two little sisters. We have the same parents. They're identical twins. They're mono twins, which are the rarest type. They had the same amniotic sac. But that being said, the cord was pinched for one of the two. Their names are Abby and Addie. Abby, her cord was pinched, so they had to have an emergency surgery. And when they were born early, one of them was 3 pounds lighter than the other. And so even though they share the same DNA throughout their childhood, when you look at pictures of them, it almost looks like the same individual, but like 3 years apart. But they're twins. And a lot of people wouldn't believe, like, it's super obvious that they're sisters, but not that they were
Oh,
twins.
okay.
So interestingly, even though they have the same DNA, they both got one of the gene variants that I got, but they didn't get both. And they got the one that we seem to have gotten from our father instead of the one that we seem to have gotten from our mother's side. And one of them is pretty severely affected. Uh, and that's the interesting thing. Different individuals, even in the same family, can have be affected in different ways. Uh, and she's given me permission to talk on this. Her spine is S-shaped, and it's she's probably never going to be able to work. As I said, they're 9 years younger than me, because she has so much difficulty walking and pain and just daily function. She's also got a lot of the same, we didn't even talk about gastrointestinal features, but a lot of the anxiety and depression actually come from the irritation of the gut lining. The gut and all of that can releases a lot of the same neurotransmitters that the brain runs on. And once those are in your bloodstream, your brain can't necessarily tell where it came from or what it means. So, especially if you have a trauma background, your brain can come up with reasons for those feelings, and that's part of the problem. But that turns out why I wasn't recovering largely from my PTSD, and the status of my PTSD at this point is dependent pretty much entirely on how my mast cell is doing.
Okay.
If my mast cell is not flaring, I really don't have that much anxiety or depression or other problems,
Okay.
or flashbacks or anything. But if I start to have them, you better believe it's not very long. I'll start to have physical symptoms as well if I'm not already.
Got it. Got it. Well, we appreciate you taking the time to talk to us because your story is not just educational, but it's massively inspiring.
Mhm.
And we'd like to thank you for sharing your experience so openly. You're helping to shine a light on a condition that really goes unnoticed and is misunderstood. If this story resonated with any of our other listeners, and if you suspect that you have MCAS, please seek out a knowledgeable immunologist or allergist and keep a symptom diary as a first good step. Um, would you like to share any of your social media information with our listeners?
Yeah, if anyone would like to reach out to me, they're certainly welcome to do so. I'm Ariana Blockmon on
Okay.
Facebook, Ariana, B as in boy, Lockmon. I end up helping people figure out where they're going with their medical journey, even if it's not necessarily where I'm at,
Mhm.
quite a bit, and it's not something I charge for. I'll just help direct them to resources and that sort of thing because I know how lonely this is, especially when you're on your own.
Excellent, excellent. And we're going to put resources on the page for this episode as well. So we really appreciate that. Thank you for tuning in to Podcast DX. Please
And
subscribe and share this episode with someone who might benefit. And join us next time as we continue to explore real life health journeys.
And thank you. Yeah, thank you for taking the time. We really appreciate you rescheduling and um, providing everyone this information. It's valuable. You are a valuable resource, and we really appreciate you taking this time to talk with us.
Yes, for sure. For sure.
Thank you very much for having me and for getting this information out there. Hopefully, it can help people not have so long of a
Right.
journey to get to
Sure.
treatment.
Yeah.
Well, let me take a break and tell you when this episode should be posting. And what I'll do is, after it's edited, I will send you a couple of links.
And while she's doing that, I'm going to just do our outro.
Okay,
This
go ahead.
podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or a treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard in this podcast. The views and opinions of the guests and hosts of this show do not necessarily reflect the views of Podcast DX, LLC.